So I know we're a few minutes over. So first of all, let me just thank all of the presenters and check, have we time for maybe one or two questions if there's any burning questions? Paula.
It's Paula Mullen, Bon Secours. Michelle, I've just got a question for you. It was a very interesting presentation. And if I'm correct, you mentioned measuring the person-centric outcomes from the electronic record. And I just wonder how you quantify or score that and what do you use as a comparator?
It's a mixed. Yeah, it's on. Yeah, we're going to use we're using a mixed method overview. There are some tools available. So we've done a context assessment index to start with, and a workplace critical cultural analysis tool to start with as a baseline. We will then kind of look at the questions that are embedded in our nursing record, like, for example, the patient involvement in the handover, patient involvement in different aspects of care which are incorporated into our preset documentation. So we will have a mix, and then we will also then be able to give questionnaires to the patients, observational audits, and looking at different. So we have different mixed methods that come in that are evidence-based and used worldwide. So it's a triangulation methods. Okay.
Okay, thanks, Michelle. Any questions? While you consider, if you have any more questions, maybe I'll have one question for. I was completely wowed by the level of innovation and the range of actual presentations. So thank you to all of you. Gillian, your summary slide was fantastic. It was, in terms of the positives and the gains for the CyberKnife technology. And I just, any downsides, because it seems so positive. Was there any surprises or challenges that you have to deal with?
Like I was saying, we've treated 450 cases. Downsides would be possibly patients with large brain tumours, with metastatic brain tumours that might end up, if their tumour was greater than 3 centimetres or something, that they may end up with intracranial pressure from inflammation and that kind of thing, and then end up being admitted for a couple of days, or somebody may be on steroids, or a lot of the time you may be treating close to nerves, and the nerve can be so tiny that it might be abutting against a tumour, you have to treat it, or you're treating trigeminal neuralgia and they end up with nerve problems. But overall, we've had, I was saying, I could count on 2 hands how many patients actually had serious problems following treatment. The prostate patients, we've treated a limited number of prostate patients, but the side effects compared to conventional radiotherapy, with patients having rectal bleeding and long-term bladder issues, we've had absolutely 0 problems with those patients at all. Wow. So outcomes and success rates so far. We're doing a study at the moment on trigeminal neuralgia and its outcomes. That'll be published shortly, so keep your eyes out for that.
And a similar question to yourself, Stephen. Any challenges? Again, the robotic surgery sounds so promising, and so I can imagine if I wanted a hip transplant, I would also opt for that. But any reasons not to?
I think that the main reason not to at the moment is theatre time usage. It will be slow to introduce initially, but I think that when you talk to high volume surgeons, guys who've done a couple of thousands of these, they talk about maybe spending an extra 10 or 11 minutes performing the procedure, and it's time well spent.
Sure.
I think it's going to take a little bit of time to change the culture within Ireland and establish surgeons' attitudes towards it. But it'll come. It's a movement. It's happening.
Good, in the right direction. Okay, I'm just looking to see if there's any other questions. I think not. So it just leaves me to thank all of you, to thank Mike, Stephen, Caroline, Michelle, and Gillian. Thank you all for your excellent presentations. And I hand over to